Hello parents, myself Dr. Anupriya. This course is about decoding newborn cry. Isn't that the most mysterious question which you're having? So let's decode it together. We'll learn about why do newborns cry, what are the different types of cry, the causes of cry, the 5S soothing techniques and the other techniques too. When should you be worried and visit your doctor, prevention of the cry and self-care for parents. Let's start. Parents, crying is the primary and most powerful way a newborn can communicate their needs and discomfort. It's their only way to tell you that they need something. Crying can signal a range of needs including hunger, a dirty diaper, need for warmth or coolness, tiredness, loneliness or overstimulation. Newborns have different cry patterns and intensities. Parents gradually learn how to differentiate them. It's important to understand that crying is a normal and expected behavior in newborns and doesn't necessarily mean that you're doing anything wrong. Let's learn what are the different types of cry. So first is hunger cry. It often starts as a whimper and gradually escalates to a rhythmic cry, maybe accompanied by rooting reflex, that is turning head and opening mouth or sucking on the fists. Next is the pain cry. It's typically loud, high-pitched and sudden. It may be very intense and be accompanied by arching of the back and drawing up of the legs. Fuzzy cry, a whiny, intermittent cry that may indicate some kind of discomfort, boredom or seeking attention. Tired cry, it's often a rhythmic cry and accompanied by eye rubbing, yawning or fuzziness. Overstimulated cry can be high-pitched and frantic with the baby turning away, arching back, flailing the feet or flailing their arms. Causes of baby cry. First is the hunger. It is the most common. It often starts as low-pitched rhythmic cry and may escalate into frantic cry, accompanied by rooting reflex, sucking onto fists and fingers, and lip smacking. Can be due to discomfort. So soiled diaper, irritation from the urine or stool, temperature, too hot or too cold, clothing, tight, itchy or uncomfortable clothing, diaper rash, and being in an uncomfortable position. Tiredness. Newborns need a lot of sleep and can get overtired easily. They can be whiny, fuzzy or intermittent, accompanied with yawning, eye rubbing, irritability, need for comfort and attention. Babies crave a lot of closeness and interaction. They may be generally fuzzy or the cry that stops when held. Baby would be making eye contact, reaching out. Gas and colic. Gas can be due to the trapped air in the digestive system which causes discomfort to the baby. Colic, intense, frequent, prolonged cry with no apparent cause. The cry may be loud and intense with arching of the back and drawing up of the legs. Overstimulation. Too much of light, noise, activity can overwhelm a baby. The cry would be high-pitched and frantic. Baby would be turning away, arching the back, flailing arms. Pain or illnesses. Illnesses like ear infections, colds or teething can cause pain and crying. There will be persistent high-pitched cry which is not the usual baby's cry, can be accompanied by fever, lethargy, cold, cough. Allergic reactions or itching can also cause crying in babies. Soothing techniques. So there are these 5S which works best when done in combination. But make sure that you're following safe sleep guidelines. So first one is swaddling. So wrapping baby snugly in a blanket to mimic the feeling of being held tightly in the womb. This can help your baby to reduce startle reflex and promotes better sleep. The second S is side or stomach position. So holding a baby by their side or stomach can be calming for your baby and may stop crying. But make sure that you place your baby on their back when you put them to sleep to prevent SIDS. The third S is shushing. Make a loud shh sound near the baby's ear. This can mimic the sounds they have heard inside the womb. The fourth S is swinging. Gentle swaying or rocking your baby can be soothing for them. This can be done in your arms, rocking chair or a baby swing. The fifth S is sucking. Offering a pacifier to your baby or letting your baby suck onto your fingers can be soothing for them. Now coming to the other soothing techniques. So first one is skin to skin contact. Holding your baby against your bare chest can be incredibly calming and help them regulate their temperature and heart rate. Second is warm bath. So a lukewarm bath can be very relaxing and ease the muscle tension. Gentle massage. Massaging over the baby's tummy or back can help release gas and give them comfort. Fourth is white noise. Playing continuous calming noises like turning on the fan, vacuum cleaner, or a white noise machine can mimic the sounds which baby heard in the womb. Fifth is movement, like rocking, walking. Gentle rhythmic movements can be very soothing for your baby. You can do that in your arms, a rocking chair, or a baby swing. Changing the baby's environment, singing to them, talking to them, or taking them out in the fresh air can also be very soothing for your baby. Now, when to see a doctor? When a baby under 3 months of age has fever, that is a rectal temperature of 100.4 or beyond, it's a medical emergency. You need to see your doctor. Baby is lethargic, drowsy, difficulty in waking up. Next, difficulty in breathing. If the baby has rapid breathing, wheezing, grunting, unable to breathe, you need to see your doctor. Vomiting. If it's forceful, frequent vomitings, or if it is projectile, bloody, green in color, you need to see your doctor. Inconsolable cry. Crying that is persistent, high-pitched and cannot be soothed even after the usual comfort methods. Refusal to feed. The baby is not eating or drinking anything and is showing signs of dehydration. Baby has a stiff neck. There are rashes which do not fade when pressed, or swelling or redness in the abdomen. How to prevent your baby from crying? A few things which you can do. So, establishing a routine, a predictable schedule for your baby sleeping, feeding, and playing can regulate your baby's need and reduce fuzziness. Responsive feeding. Feeding your baby when they show early hunger cues and not waiting until they are extremely hungry and cry. Safe sleep practice. Ensuring a safe sleep environment is very important. You don't leave any loose blankets, use firm mattresses, and let your baby sleep alone in a separate crib but in the same room. And always make your baby sleep on their back. This will prevent any discomfort and promote safe sleep. Reducing overstimulation. Creating a calm and quiet environment can be very helpful to soothe your fuzzy baby. Take measures to reduce colic or gas. So you burp them after every feed, give tummy massages, give tummy time daily. Provide comfort and cuddles even when the baby isn't crying. Address any physical discomfort promptly. Parents, self-care is very important. Taking care of a crying baby can be very exhausting and stressful. It's very crucial to prioritize your own physical health and mental health. Don't hesitate to ask help from your family, friends, or a support group. Sharing the burden can make a huge difference. Take breaks whenever you can, even if it's just for a few minutes. Practice relaxation techniques and prioritize your sleep. And let me tell you, it's okay to feel overwhelmed. It's okay to place your baby in a safe place and take a break whenever you need.